I think there are some technology things that are changing already. Pumps have been around a long time. There are pen injectors that have been available, but you still need insulin because it's a condition of insulin deficiency. But what has changed is the ability to monitor glucose continuously, what is called a continuous glucose monitoring system. In fact, this weekend there's a conference in Washington that I'm chairing on a consensus of how to use this effectively in practice. And what has changed in technology is the communication between the sensor and the pump, so that the sensor can turn off the pump when your blood sugar is going low. And I think that's a tremendous advance. So we're looking at ways to ultimately mimic what the pancreas does, the so-called artificial pancreas, where you can switch on insulin when you need it, switch it off when you don't need it, give a hormone called glucagon when you're really dropping very low. That's the way the pancreas works, and we want to do it in an artificial way. That is actually technically possible today, where we're looking for ways to do this effectively. We're also testing out some of the treatments that are available for type 2 diabetes in type 1 diabetes. So actually we're just starting a trial of a very interesting class of drug called SGLT2 inhibitors that make you excrete glucose in the urine. They've had tremendous results with that in type 2 diabetes, and we're just starting a trial of people with type 1 diabetes who are just on insulin alone, either with a pump or with injections. And we are very excited about looking at this approach for type 1. Well, there are concerns with any medication for side effects, and these are relatively new, so we need to watch them very closely, which is why in a clinical trial you're actually watched better than in practice. And we're doing some trials in type 1 with type 2 medications. I think that's a good approach. I think the ultimate goal is to find a cure for diabetes, but let's get real. The cure is not just around the corner. There are approaches that are working towards the cure. The American Diabetes Association, which I'm very involved in, I've been a past president of for science and medicine, and that's our vision. That's our ultimate goal, and we have a program called Pathway to the Cure. And we hope that one day we will have a cure for diabetes. But for millions of people who are living with diabetes today, there have been tremendous advances, and our role is to make sure that the right person gets the right treatment so that they live well, so that when a cure comes, they're still healthy. I've been working in the field of diabetes for about 30 years, maybe a little bit longer, and the things have changed dramatically. When I first started, you had very sick people. You know, I used to see several people who were at risk of having an amputation in the next few weeks, or risk of dialysis in the next few months, or people going blind. This was a very common thing. So yes, the overall numbers were smaller, but they were very seriously sick people. Today we have large numbers, which makes diabetes more suitable to be managed out in the community. It has to be. But we have the tools to prevent those late complications. So I haven't sent a patient for an amputation for years. The future is really in prevention of type 2 diabetes because the numbers are just too large. It's overwhelming budgets, people's budgets, government budgets, and this is all across the world. So we need to take steps to get people to diet and exercise. And if you think about it, rather than on an individual way, we need societal change to make that happen. And we need to encourage people to use a bike and walk more and make healthy choices with eating and live a better life that's healthy. I think it's actually happening. Obesity has plateaued, believe it or not. You may not think that when you look around you, but if you look at the data, the number of obese people in this country has not increased in the last 2 or 3 years, which is very encouraging. It's actually beginning to turn the other way a little bit. It's certainly plateaued in children as well, which is another, I think, very encouraging sign. So I think we can win this battle. It's doable. The means are there. We're doing studies. We're just starting up a study where We've learned a lot about treating obesity in major clinical trials in specialized centers, but we need to take it to the community. So we're actually, with the leadership of Pennington, and we're partnering with them on this. We are actually going to use those same techniques used in the trials in primary care practices, in federally qualified health centers, out in the community clinics, to see whether you can have as much success in the community, because that's really what we want.